Uh, I would like to welcome everyone to our dialogue today. My name is Stephen Richards. I am chair of the Richard Richards Foundation, together with the Richard Richards Institute for Ethics at Weber State University. We are joined by two distinguished guests, Captain Stephanie Evans of the Nebraska National Guard, who is a critical care nurse and has been worked with the Czech Republic as part of the state partnership program related to COVID response. And we are also joined by the distinguished parliamentarian, Chairman Petr Kremsky, who is chairman of the Economic Affairs Committee of the Slovak Republic. I want to welcome them both to this dialogue. And the objective today is to talk about their individual experiences and perspectives of COVID management. Captain Evans can speak to it from the individual and public health perspective based on her experiences, as well as Chairman Kremsky can talk about the individual and national economic health challenge that COVID and pandemics challenge us. So to begin with, I'm going to ask them to each just make observations about their pandemic experience to date. We've been challenged by the pandemic for a few years. We have these various waves of infection that impact individuals in the public. And if each of you wouldn't mind, and we'll start with Chairman Kremsky, just sharing your current perspective of the pandemic, and then we'll talk about best practices and possible tools going forward. So Chairman Kremsky, just your current observation about the pandemic to date, and then followed by Captain Evans.
Good afternoon here, good morning in States. It's a big pleasure for me to attend this discussion. What is on my heart now, we are in the situation both in the States and in Europe. They are awaiting a new version of virus, new mutation, Omicron, and we don't really know what is awaiting us and what is coming and what it will bring for our countries. And I really appreciate if we can speak about our experience in last months, and we can exchange these experiences and help each other to manage it better in the future, because probably it's not the last wave and last mutation, and we have to develop real strategies how to manage it without losing the economic route and economic activity in our countries. Our experience is not very nice in last year because we had really bad second wave in December, January, and February, and with many deaths, and especially older people. But what is our experience is that with efficient help, we can protect companies and economic problems, and we can avoid the economic problems. For Slovakia, it's especially car industry, because we are the top in the car production on the inhabitant, on the head, and world top. And it's very important for us to protect this industry, because we want to be the reliable partner in the future as well. And this what was very good that we managed to protect these industries. We had almost no cases that it would spread in the factory with high numbers, and there was hardly a company which should really close because of the COVID. So this was very good experience, and our good experience is testing. We was probably the first country in the world who really tested all inhabitants in 2 weekends, and it helped to stop the growth of cases in November last year. And then it was really the people were due to get tested every weekend, and in factories it was even more often, and it helped really to protect the jobs and the companies.
Thank you.
That's our experience, and maybe more later.
Yes, thank you. No, that's a very good summary. I appreciate that very much because again, we're going to talk about practices. To your point, this isn't the end of the pandemic. We're in the pandemic. Captain Evans, your kind of general observations, experience to date from your perspective?
So since the beginning until now, I think we've come a long way in how we were treating people. The first few patients in the ICUs, our practice from then, we were quicker to intubate our patients in the very beginning. We were, our ventilator settings, we would use different ventilator settings than we do now. So we've learned so much to wait as long as possible to intubate these patients, just because it's a known fact that once someone is intubated, it's harder to extubate them and take out the breathing tube. So we have done better in the last 2 years of learning how to manage these unfortunate patients. With each new wave or each new variant of COVID that comes out, at the very beginning, it was more of the elderly population. But then with Delta coming out, we saw that younger 40-year age population. And then with this Omicron, now we're seeing more college age is what it's been predicted is what we will see, because that's what has been the first cases. So I think now, 2 years into this pandemic, you're absolutely right. It's not going away. And we just need to accept that our new norm is going to be protecting individuals from COVID. And I think that we've learned to put in the best practices, and as long as people will follow those practices, as far as social distancing, masking up, avoiding the big crowds, I think if we could get more people on board, I think we would see less numbers in the ICUs. If we could get everybody to be vaccinated, because that is our struggle in America, is getting everybody on board with getting vaccinated. Since anybody who is fully vaccinated, we see less hospitalizations, less deaths by a lot. So it's just what we need to do better is educating the general public and giving them the right tools to make the decisions. And I think we would be much better off if we could continue to push the vaccinations. Our ICUs would be less full, our patients would be less critical.
Yeah, thank you very much. I want to just kind of do a little bit of a juxtaposition of the individual impact and then the broader impact, community impact. And so Peter, I'm going to ask you second. I'll start with Captain Evans, but each of you kind of talking, Captain Evans, from a health perspective, just maybe an anecdote of individual impact. You see a lot of cases in the ICU, and then community, and you've talked about it, but if maybe your experience going back a year to the Czech Republic, talk a little bit about that, or comparative of what you see in the US and what you saw with that trip. And then Chairman Kremsky, if you could talk about the economic challenge for an individual in terms of jobs, and then the community, because I think this is, to your point, Captain Evans, this really is a community effort to address the pandemic, but we all have individual freedoms. We all have an individual choices, and there's quite a challenge. I think the U.S. and Europe might be slightly different in their approaches, but if we could talk about the impact individually and then community on the health side, and then economic. So Captain Evans first, and then Chairman Kremsky.
So going back a year when I went to the Czech Republic, it tends to happen that when I have these talks, it's when we're in a spike as well. So people are asking me for my advice. And in the meantime, my ICUs are overwhelmed. But when I went over to the Czech Republic last year, I went over to a country where when the government said to shut down, it shut down. The people listen to their government much better than what we do in America, because we have such a huge freedom of choice, and we can make our own decisions. That in America, it was people going to social media and looking on the internet and finding their own information. And unfortunately, it wasn't always the most accurate information. I don't think people always thoroughly research before they make their decisions. So in America, I see people not always, it's been more of a struggle to get people to vaccinate. So our ICUs are full of like 95% of our ICUs are unvaccinated patients. When I went over to the Czech Republic, it was almost satisfying to see, because we were shut down in America at the same time, but some businesses were still open. Not everybody was willing to mask up. Whereas when I went over to the Czech Republic, it was completely shut down. There were masks everywhere. When we took the trains to go back and forth, you would get a dirty look if you stepped on that train without having your mask on. So it seems like the public took more of a little bit more assertiveness in making sure that everybody was being safe. And even though they were having the same spikes, they were not as severe in the Czech Republic spikes as what we were having. Their ICUs were not yet overwhelmed, when in America, ours were overflowing. So it was a huge difference between the two countries.
Thank you. Chairman Kremsky, you alluded to some of the practices, particularly testing. Just in terms of a broader economic perspective, you want to talk about the impact that the pandemic has had on the economy, and how, or individuals who might, individual businesses that when there is a shutdown, it has a significant impact. And of course, economically, they are, asked to sacrifice some bit. But you want to talk about the economic impact?
Yeah. And first of all, it really surprised me if someone who is coming from the States is admiring our discipline, and sometimes we have really the feeling that it's not enough. It's still there are many people who are not wearing the mask and are not willing to get vaccinated and so on. But I think still in these countries in Central Europe, there is some kind of discipline from the communist times. what's not nice, but in these difficult times, it helps sometimes. But what I see is that in the first year, the willingness of the people to really trust the government and trust the experts and the be patient and so on was much higher than it's now. In the first months, in March and April 2020, it was really strong discipline and strong feeling that we have to hold on for some weeks and it will be over then. And now in this second year, I think it's much worse because people are tired of wearing the masks and to stay home and to have this shutdowns and lockdowns and so on. And in this second year, we rather have shorter lockdowns, but very strict, and with the hope that it will help to overcome the worst times and to open again. So this year in September we started with worst regions in the beginning in north and east of Slovakia, with colors which where it's better and where it's worse, and in more dark colors there should be the shops shut down and restaurants and so on. And but in end of November all the regions became black because the hospitals were full. And it's the time when you think about the dilemma that if the shops are open and restaurants are open, or the people will die, or the people are dying because there is not enough beds in the hospitals. And in this situation, the government decided to have 2-3 weeks lockdown to bring it down and open again before the Christmas. What was good decision, and this is. I think this is the way how to avoid the more economic problems and economic impact. So I think the methodologies and the way how to manage it change in the time. And I think with the new versions of COVID, it should change, and the exchange of experience can help us to adapt maybe new best practice from the other states and to manage it better.
Yeah, thank you very much. And that is a good lead to this next question. And that is, what are some best practices that we have identified? We've spoken to it already, but Captain Evans, in terms of the medical treatment, do you want to talk about things that might be on the horizon, or technologies or techniques in terms of addressing the actual treatment of patients? You have alluded to it, spoken to it a bit, but if you could maybe speak to it as you look forward, because I think this is the key. The key is to have better practices, better technology, better communication, and we can talk about that as well, education. But I don't think we're through with this particular pandemic, and we don't know what's coming. And then Peter, if you could also talk on the economic. I think the testing, the support you have for your industry, maybe the partnerships. Captain Evans, you could talk about testing as well. But best practices, Captain Evans, your thoughts?
So what we're doing as far as treatment in hospital, it's pretty stable with what we're doing at my hospital. You know, we tell the general public to take care of it as much as they can at home. Don't come to the hospital unless you absolutely need it. That way we're not flooding the hospitals and possibly taking up beds for someone who needs it more critically. The treatments of our patients in our ICU right now, we're pretty much set on, you know, when someone has the virus, the remdesivir, the antiviral IV medication, that's been helpful in decreasing the severity and getting our patients over it quicker. And then we also do the dexamethasone, the steroids, for a number of days. That hasn't changed a lot as far as, I know there were some adjustments with the number of days that we would keep our patients on, but otherwise, the thing about COVID is once the body has it, we're basically supporting the body while it fights through it. So in the ICUs, you know, it's our patients when their respiratory drive is finally so worn out, then we'll intubate when it's time for that. So we'll put in the breathing tube, we'll put them on a ventilator to let their lungs rest, so that way they quit fighting to breathe while their body works through this. There are times that the COVID fever is what people have, then we'll support the body in trying to keep the fever low enough that it doesn't do more damage. And then it's supporting them with you know, blood pressure medications or whatever it takes to get them through it while the body continues to fight on its own, because there's no way to completely rid it of this virus. It's just helping it through until we're done. As far as our non-hospitalized patients, we're doing the monoclonal antibiotic infusions as an outpatient treatment. And we see that people who have gotten COVID, but it's not severe enough to be hospitalized, it also helps them get over a little quicker. Right now, we're doing a little bit of research and possibly looking at doing those antibody infusions for our more at-risk population, the elderly, the immunocompromised. So that's something that may be used more as we continue to fight through this pandemic. As far as the public, what we're encouraging them to do is just the things that we've been doing all along, you know, socially isolate as much as you can, choose those outdoor activities versus the indoor activities. So trying to keep people from contracting the virus as much as they possibly can. You know, if you can stay home, do it. Make sure you wear your masks. And it's just up to the individual to take as best care of themselves as they can. We hope to get out the best information. That way they will mask up and they will vaccinate, instead of being part of the general that, once again, is tired of masking, is tired of hearing about this pandemic. They just want to live their life. So right now we're fighting that. Whereas if we can get people to vaccinate, we see that the cases are less severe, there are less deaths. So that's our best practice that we've been trying as hard as we can to educate the public with.
Well, I thank you. I have a follow-up question. It's a little unfair, but if you looked at a hospital administration perspective going forward, would you organize, commit resources more, you know, how would you kind of look at ICU? Where would you invest if you were in that position to invest, or in other areas in terms of hospital management? I don't want to, you know, this is a bit of speculation, but just based on your experience and from investing in critical care and in hospital care, any thoughts you would like to share?
From what I've seen, if we can get the general public to, it starts with having them take accountability for their own health, being as safe as they can, and avoid coming into the hospital if possible. But I think as far as the patients who actually, or as far as the people who actually contract the virus. I think from a hospital administration, I would push for more of the outpatient infusions for the patients who do get COVID, to hopefully help them fight it more on their own, so it doesn't come to that critical level where they do have to come into the hospital. So it doesn't go to the level where they do have to take up an ICU bed. If we can avoid it and prevent them from getting that sick, I think that would be ideal, because in the hospital, we're still, not only are we struggling with ICU beds, we're struggling with staff. We don't have enough nurses. We don't have enough respiratory therapists to take care of all these amazingly sick people. So prevention and decreasing the severity is what I would definitely focus more on, because once you get to that critical level, you need that whole support system. You need all that medication. You need all that machine technology to help out. So prevention and decreasing severity is what I would really, really push my efforts towards.
I'm a layman, and so just if you wouldn't mind, the infusion, just describe that a little bit more, what that is.
So I haven't had a lot to do with it. I've just been kind of following it in the background. Right. We set up an infusion center, and I had to look it up just so it's an antibody infusion. It's a monoclonal infusion that we started doing at our hospital. And I can't even pronounce the name of it. So
right.
But we are, for the patients who don't quite need the hospitalization, it's an IV infusion that they come to the clinic for. And if they're evaluated and it seems that it would help them, then they're getting this infusion. I honestly don't know enough about it to say how many infusions they're getting, but they're seeing that it is helping the body. It's an antiviral antibody, so it helps the body fight it a little bit easier. So that's why there's talk about giving it to people with immunocompromised systems before they even get diagnosed with it. So it's
okay. That's very helpful. Very helpful. Peter, do you want to talk about going forward from managing COVID and the economic impact? You talked about testing. Is there discussion about further strategies that you're considering from a public management of COVID, particularly as it impacts businesses and the economy?
Yes, I think the most important strategy is vaccination, but there is still a big discussion in Slovakia now as well. What we have to do with people who don't want to get vaccinated, if it should be obligation or not. I'm not advocate of obligatory vaccination. I think it's on the freedom of every man if vaccinated or not. But when someone is not vaccinated, he should count on that there will be some limitation in his life, because it's for the country, for the state, more risk than when someone is vaccinated. And in Slovakia, in this time, for example, we have limitations for people who are not vaccinated or not recovered, that they can't go to the shops, for example, to shopping centers. And it's very, very difficult for many people, big challenge that before the Christmas, they are not allowed to go to shopping center. If you could imagine it, it's not easy for them, of course, but it could not go very, very long time. Maybe when the situation is a little bit better, the shopping centers will open for unvaccinated people as well with tests. And this is a big challenge, this testing, because in the entering of the buildings, measuring the temperature and so on, it's a big challenge for technology to bring good solutions, because it's costing time. When people are entering the industry factory, for example, 1,000 people for a shift, it's really not easy to manage the entering and to measure them and test them and so on and so on. Now, for example, we have this automatic temperature measuring in many buildings, and I heard about the technology that people are testing by their hands. They just put their hands on some screen, and it for 5-10 seconds, and it's showing if they are positive or not. So the technology is going further, and we have to develop very good solutions for people who are not able to get vaccinated or they don't want. For example, for traveling, for transport, for mass events, I think we will, in next year, people more and more will want to have a life as before, not stay at home, to not just be careful and to not travel, not go to concerts, not go to theater or sport. And really the technology is able to bring new solutions to ease this process. So I think this is very, very important. And of course the masks, the vaccination and the hygiene and so on. But with the new versions, which are more and more contagious, it's more and more challenge how to get the people safe, of course.
Yeah, I wish, we all wish that we were at the end of the pandemic. The topic that is management of the pandemic. So we are in process. I think technology is working, practices are working to a degree, but the fatigue factor, if by individuals, is real as well. And you know, there are issues of, we've talked about our health and personal health and economic health. Mental health is another big issue. You know, I mean, the longer the pandemic goes, I think it has a negative impact on mental health for individuals as well. And so it's a real challenge. We're at the end of our discussion. I would hope that we could collaborate, we, the United States and Europe, and in this case, specifically Slovakia, we could collaborate at a higher level. The foundation would love to promote that dialogue. And I think there are questions, you know, we might have, Peter, you raise an issue on technology. Maybe we have a discussion that's focused on technology and how that will address it. Captain Evans, your comment about infusion and that practice and technique, that's an interesting health management perspective to avoid people being admitted to the hospital as they go. I'm going to give you each a chance to make a last comment, and then we'll sign off. But I personally appreciate you both being willing to join us. I wish we all had the resources and the technology and the practices in hand, but it's an evolving process. Peter, you want to make a little summation comment, and then Captain Evans?
Maybe, as you mentioned, the psychological health is same important as physical health, and this strong pressure on our lives in last 2 years is hurting our psychological health as well. So I think it's very, very important to have focus on this issue as well. And these limitations and all these things are very, very hard. So I wish to you all to have next year really much, much better and more free.
Thank you, Peter. Thank you, Chairman. Captain Evans?
For me, yeah, I definitely agree that mental health has really taken a hit. I feel like with Zoom meetings and FaceTiming, and I feel like people are trying as hard as they can, and they Zoom their families, and they talk on the phone as much as they can. But yeah, at some point you're just so tired of being alone that you have to have that physical interaction with the rest of with the rest of your family, with the public in general. And I think that's important for people to do that. But I wish that we could really enforce the mask mandates. And if people, I think it wouldn't be, it's very detrimental to see people go out in big public areas, with the big crowds, because what's going to happen is that the spread of the virus it loves the crowds, and it loves people not wearing their masks, and it loves the unvaccinated people. So I definitely think it's important to protect everyone's mental health, but we would be much better off if we could continue to push for the vaccinations and push for the mask mandates, and as much as we can, so that way we can protect both. We can protect the mental health as well as the physical health and the virus prevention for people. And I don't know how to do that, but yeah, more education, I guess, and then more research on the virus and contact tracing and all that. I just think, yeah, as much emphasis as we can put on learning as much of these viruses as we can, and with each variant, tracing it and studying it as quickly as possible to at least mitigate the spread of it as much as possible is the only way we're going to keep continuing to fight through this pandemic.
Yeah, well, thank you both for joining today. I wish we were looking back on this. We're still looking forward. I think it will prepare us for future challenges. I think I like this technology, and maybe that's we'll look to focus on some of these advanced techniques and technologies that could be implemented. I thank you both. I hope each of us we all come away with an appreciation for the individual impact on health and economic vitality, as well as, how as a community do we share the burden to ensure health and economic vitality as well. It's a challenge that is for our age. We just have to meet it. I thank you both. We will look forward to intersecting maybe in the future, and appreciate everybody making time available today. Thank you for joining us all.
Thank you.
Thank you. My pleasure. Merry Christmas for everyone.
Yes, thank you, Peter. Merry Christmas to all. Thank you.